Call to order. The time is now 11:31 on February 2nd, 2023. We would like to welcome you to Partners Health Management, Mental Health, and Substance Use Committee. I'm Susan Stevens Kennedy, the founder of Teal Drops for Substance Use Prevention and chairwoman of this Mental Health Substance Use Committee. I would like to thank you for attending today's community conversation on opioids and substance use. The Mental Health Substance Use Committee meets the first Thursday of each month from 11:30 to 1 p.m. Today will be a short session. We are closing at 12:30, and the intention is to make this a hybrid meeting going forward. However, we're trying to secure the space, so today's meeting is only through the Zoom meeting. We're continuing to make the Zoom calls, and we'll shortly be, making the meetings in public. The purpose of the Mental Health Substance Use Committee is to promote community engagement and to try to get the community involved, people that have mental health and substance use or live with someone or love someone that has mental health or substance use. We want to bring them to the table. It will help the community and help the Partners Health Management to provide the right resources and making sure that we are hitting the right goals. It will these conversations will help us partner together and to make our community better, stronger, and make the people that are suffering the most have the right assets and the things that they need to promote wellness and health. So thank you for joining us. A little bit about me. I have 7 things that concern me, and one of the big one is lock your meds. So one pill can cause a domino effect. I left my pills unlocked. My daughter took one to school. She ended up getting caught with that pill, and I said arrest her, thinking that just tough love and that would save her. And that one pill led to her being arrested, and the public defender assaulted her. She suffered from PTSD, and that was just the beginning of my daughter's downward spiral, heroin addiction, injecting even fentanyl, which she died January 22nd, 2018, which led me to my journey and why I'm here today. I went and received a master's in addiction at Wake Forest to try to combat and help someone never have to live my story and with the loss of their daughter. So with that, I am very passionate about mental health and substance use. So there is some mental health issues in my family, my mother, my father, even my daughter with the PTSD. So I want to remove the stigma. Everyone here wants to remove the stigma, and we all know that this is a community effort and a community disease. With that, I'd like to introduce Matt Potter. They are our sister community and committee. So Matt, will you tell us a little bit about the committee that Partners has with you?
Absolutely. So I'm Matt Potter. I am the current acting co-chair of the Partners Behavioral Health Management Intellectual and Developmental Disability, or IDD, Advisory Committee. And as Susan said, we are essentially a sister committee to the Mental Health Substance Use Advisory Committee. We ourselves meet the second Thursday of every month at 5:30 in the evening. That's when we meet, but the format of the committee is pretty much exactly the same. The goal of the committee is pretty much exactly the same. And what we also do, as does the MHSU Advisory Committee, is we also thanks to funding from the county, are able to give out small dollar amount grants to help fund community programs from, partners, not literally partners as in the organization, but partners as in people who are working with us on these issues to help provide answers for gaps in services or supplemental services in their own way. So for example, to use an example from IDD advisory, one of the things that we have funded over the years is Next Chapter Book Clubs, which is a weekly book club for individuals with intellectual and developmental disabilities. I won't go into too much detail about it, but the bottom line is that it is something that is a weekly thing for these folks, and it has a lot to do with socialization and that kind of thing. And that's an example of one of the programs that the IDD Advisory Committee has funded through these grants over the years. And again, that's all thanks to the county and the county commissioners. But yeah, our goals are pretty much exactly the same as the MHSUD advisory committee. So you can think of them as two sides of the same coin. And that's more or less a rundown of what the IDD advisory committee does. We discuss things that are issues within our community at the time, and we try to find possible solutions, as well as keeping people up to date about the moving and the shaking around partners, behavioral health, and other entities that help serve our populations. So I think that about sums it up. And with that, I believe I am going to hand it off to Jackie.
Thank you, Matt. I appreciate that. Again, good morning, everyone. My name is Jackie Copeland. I'm the Regional Director for Community Operations for Partners Health Management. And first, I'd like to say on behalf of Partners, I want to welcome all our guests and express our gratitude to Attorney General Josh Stein being able to join us today and to share his vast experience and wisdom combating the opioid crisis. I also want to say thank you to Sheriff Kimbrough for joining us today and sharing his insights on combating the opioid crisis locally. A little bit about Partners. Partners Health Management is a local management entity and managed care organization committed to Forsyth County, along with 13 other counties in the state of North Carolina. We're committed to our providers, stakeholders, and our staff, and most of all to the individuals we serve as part of the North Carolina Public Managed Care System. We do this in partnership with our county, Forsyth County, and their leadership. I've been asked to share a few county highlights of the planning underway to serve the human services needs in our county. Many of you may be familiar with the work occurring at the Highland Avenue Center. That's located at 650 North Highland Avenue here in Winston-Salem. The vision of that center is to become a more comprehensive one-stop location for individuals with behavioral health needs. The building currently is home to a primary care clinic. Also, one of Partners providers, Daymark Recovery Services, has an open access outpatient services, and there's also a 24-hour, 7 days a week behavioral health urgent care center for folks who go to if they have an urgent need, a behavioral health need. And also Partners Health Management is located in the same building. The county's future vision includes these services and much more, including a 16-bed adult facility-based crisis center. The design phase and construction is near completion, and construction will soon begin to build out the facility-based crisis center and to upfit this building's second floor for additional behavioral health services. Current services will continue to be provided at Highland Center during the construction phase. The Highland Avenue Center itself shares our community's shares the human services campus with other county entities such as the Public Health Department, Department of Social Services, and also our emergency management services, putting all those in a very close walking location for anyone needing access to those services. As part of our county's work to battle opioids and mobilization of our opioid settlement dollars, Forsyth County has posted requests for proposals for interested organizations to provide behavioral health and other services in relationship to our share of the opioid settlement dollars. What we'll do is put a link in that in the chat so folks can be aware of that, so you can be aware of that. So I'll put that in soon. Again, I just want to take time to say thank you for attending today's conversation and the partnership that's going to be forthgoing based off of this. And with that being said, I'm going to hand off to our Sheriff Bobby Kimbrough. Sheriff Kimbrough.
First of all, I want to thank you all for allowing me to be a part of the conversation. It is truly an honor. You know, when I hear conversations like that, it always takes me back to my beginning. You know, I'm originally from Winston-Salem. I spent my career, some of my career here in Winston after graduating from high school, coming back from college and starting my career with the Winston-Salem Police Department. As an adult, I spent my adult career prior to coming to the sheriff's office fighting what the President Nixon called this war on drugs, this opioid epidemic. I just want to share some numbers with you if you just think about them. I want to go back to the year which began my real concern about this opioid epidemic. If you can remember back not long ago to 2005, in 2005, in the United States, there were approximately 29,000 death-related opioid. And in North Carolina in that same year, there were 600. Of that 600 deaths in North Carolina in 2005, one of them impacted me and changed my life. One of those deaths was the love of my life, my wife, in 2005 on June the 5th. And so while most of us live our life not really understanding this thing called opioid epidemic, we say it can't happen to us, but the truth of the matter is all of us know someone that has been affected by the opioid epidemic. You know, I say this all the time when I talk and I share conversation with people is so many times in life, how I see you will determine what I'll do for you and how I will treat you or what I will attempt to do for you or do to you. And so many times in life, we see people with addictions or people that are struggling with some type of addiction as less than. We see them as not equal to those of us that may not have an addiction. And so many times, because of the way we see them, it affects how we treat them and the resources that we apply to help and save them. You know, since sitting in this office as the sheriff, I came into this office in 2018. On the platform that I talked about how important it was for us to recognize that, how important for us as a community to understand that this opioid epidemic is serious. It does not just affect the poor, the Black, the white, the rich, the wealthy. It is not a Black, white, Republican, Democrat, independent thing. It's a life thing. It affects all of us. What I would tell you is that in that year of 2019, if you think about it, in 2019, there were approximately 70,000, that's 70,000 deaths in the US. And in North Carolina, there were 2,000. So that number has jumped exponentially. And if you think about it, if you look at it in terms of how important the number is, in the Vietnam War, there was only approximately 50,000 that lost their lives. In 2019, we're talking 70,000, and the numbers are upward of 100,000 now per year across the United States. And even in North Carolina, that number has jumped. I say that to say this, is that we have to strategically form partnerships. We have to strategically form relationships with people, organizations that can make a difference. It is a truth in saying that we're stronger, better, and safer together. It is truth in saying that this epidemic is going to require all hands on deck, all hands on deck. You know, as I travel across this community, across this county, I see firsthand of the effects of overdose. I see firsthand when I walk in houses that are made of brick, rich, the wealthy, loved one laying there cold. I've been in houses that are made of wood, and the same phenomenon. I've been in what I would call homeless parks or people lying dead from opioid epidemic. And the thing that I would tell you is that it has no respecter of race, color, creed, or even economic status. And that tells you that it affects all of us. And so I'm grateful when I met Susan. Her and I bonded from sharing stories. For so many times, people lose loved ones, and we are ashamed to tell our story. You know, I myself was ashamed to tell my story because even in death, we want death to be respectable. We don't want to say that someone we know or love died of an opioid or an overdose. It's such a nasty word. It's like, oh, they caused their own thing, not knowing the whole dynamics behind that. And so when I see people or I meet people who are truly committed to this, I lend my support to them because it's not getting any better. If you look at the numbers that I gave you in 2005, where I said approximately 29,000 people died in the US and 600 in North Carolina, that's 2005. And then you look at it 14 years later, where you have 70,000 people in the US and 2,000 in North Carolina. And if you look at the 21, we in 23, look at the numbers are up with 90,000 people in the United States that have died of an opioid epidemic. At some point in the next 2 to 3 years, we will exceed 100,000 people dying yearly. That's the people that we know died of the opioid overdose of the epidemic. Those are the ones that we can count. Now, there's a number out there that we missed. There's a number that died from death-related illnesses that are tied to the opioid. These are the number that we know, here's what the cause was, and we can say they died of this. And so I say that to say this, is that we've got to get serious about the business of this epidemic. We got to get serious about the people that we partner with. And that is why that regardless of what my schedule looks like, or what I'm doing, when someone says that they're fighting the opioid epidemic, when someone says to me that they have an interest in trying to make a difference, I will and always come and running. I've met a lot of people across this state of North Carolina, quite a few people. When I was running, I met a man who I have the utmost respect for, the utmost respect for. You know, my father told me, tell me where a man spends his time and his money, and I can tell you what he loves. And when I met this man, some you know, some I'll introduce to you, Josh Stein, I met him and I realized that this man has always put the people of North Carolina first. He has put the people first when he served as a senator, when he served as the attorney general. The man is a wealth of knowledge. He has been fighting for North Carolina since I met him. He was first to talk about suing the big pharmacies. He was the man that I know is always fighting to make a difference in life, not just for the wealthy, but for all of us. And I can truly say that after researching and then having the opportunity to meet his family, I understand where his pedigree comes from. You know, his father started the famous law firm out of Charlotte. Josh is from North Carolina, grew up in Chapel Hill in Charlotte. He's a graduate of Dartmouth. He's a graduate of Harvard University Law School. I mean, I could go on with a list and a plethora of things that the Attorney General, soon to be, and I hope to be the next governor, could talk about him forever. He's married to Anna. He loves playing some sports. They tell me that he played soccer in his younger years. He and his wife have 3 kids. And you know what's interesting about that is that I met his son at a forum at the governor's school. Had no idea who Josh Stein was. And this young man came up to me and was talking to me. And I was so impressed with this kid that I was like, wow, somebody has raised that kid properly, because the questions and his articulation, I could tell that this was not an ordinary kid. He never said who his father was, never said who his father was. I later learned months after that, that the kid that I was talking to was the son of our next presenter. And I present to you the Attorney General, I hope soon to be the governor of North Carolina, Josh Stein. I hope he's on the line.
He's actually not with us yet. They said he would be joining right at 12. So we've got a few minutes and we can go ahead and I do want to go ahead and invite anyone to go ahead and put any questions you may have into the Q&A. We'll be addressing those at the end. But Susan or Jackie, feel free to chime in with anything you would like to share.
There you go. Well, Sheriff Kimbrough, I want to thank you. I walked the campaign trail with you, speaking on many, many panels together, sharing your story, sharing mine. We have truly bonded, and you are a man I greatly, greatly admire. You were correct what your father said, where you spend your time and your money. That's my whole heart. That's where I spend all my time and my money is teal drops, because to me, it keeps my daughter alive. So it's near and dear to my heart. If I can help one person, and it might be a simple help. I used to pass people on the street and not give them any money when I saw them on the street asking for a handout. And it was not until God just spoke to me and told me, if somebody gave my daughter $5 and she went and used that on heroin, or she went and used that on a drug, I'm very grateful that gave her 30 minutes, maybe an hour, where she was not dope sick. And I know you know a lot about dope sick. Part of your calls, you find people where they're dope sick or they have Narcan, and it throws them into dope sick immediately. Can you share a little bit about that, Sheriff Kimbrough?
Yeah, so before I do that, I want to piggyback off of something you said. You know, as I moved across this county, I've come across families from all walks of life who've lost a loved one. And even myself, you know, the common denominator that I find, and you just touched on, is that you never forget that. You know, people say, you know, time heals it. Time doesn't heal it. What time allows is you to live with it. In other words, you learn to live with the pain. It doesn't heal it. Because you could be doing something and it will spin you back to that place. And so we always ask the question, could I have done something different? And I ask myself that on many occasions, you know, if I had known what was going on, what would I've done? And when I did find out, I found out too late. And we will spend the rest of our lives trying to figure out, could we have done something? And I say this to people that, you know, people will talk about this opioid epidemic. They will talk about it, but until you've walked in those shoes, as the saying says, the adage, till you walked a mile in my shoes, then you will understand why my feet feel like they do. And so I think that so many people look at it not with the bird's eye view. They look at it from what they see on the news feed, what they see by reading the reports, what they see in the paper, what they see on the reports that they see on the internet. But until it has actually touched you, and at the rate that it's going, it's coming to your house soon, at the rate that it's going. And so what we're finding is when people are drug sick, you know, people are spiraling into illnesses because they can't get it. There's so many factors in when you talk about this opioid epidemic. Me personally, I don't think we truly fully understand it as of yet. We don't, because what I have seen is that I have seen some people that Narcan will affect, and I've seen others that have to hit it twice just in order to bring them back. So, you know, I see people out here on the streets who are sick because they can't get a fix. I see people who come into the detention center and go through what I call the worst kind of withdrawals that you can imagine. And so until you witness it firsthand, till you smell the sickness, till you experience the grief, I don't really think you have a true picture of what's really happening. We can talk about it theoretically, but until you physically feel it and see it and it touches you, that's when the fight increases. That's when it becomes personal. And what I will say to all of you all that are listening, all of you all that are on the fence as to whether or not you should give your resources or your time, I will encourage you to talk with some people that have experienced the pain and let them share with you what they're feeling. I see you got your hand up, Matt.
I did, Sheriff. I wanted to really quickly add a couple of things. I know I'm here as a representative of the IDD Advisory Committee, but I wanted to let everyone know, both my fellow panelists and those attending today, my life has been touched by addiction multiple times. Thankfully, I have not had anyone die as of yet as a result of their challenges, but the person who I would say I love probably more than any other outside of maybe the people who brought me into this world is an alcoholic. And she is currently in recovery, which is, obviously good, but that addiction has been a challenge in recent years and in recent months. And the only reason why I bring that up is because I know that we're talking specifically about the opioid epidemic today, and I know in a lot of ways it is its own monster, but I think that it's also important that we remember that the circumstances of our world in general right now, especially with the pandemic and things like that, the circumstances that we've been in for the last few years now, I think have been a flashpoint for making any addiction problems, no matter what the substance, worse than they were before, or even creating an addiction where there wasn't one previously. So I just wanted to bring that up to say that I also walk this path with you all, even though it is not my primary area of expertise. And I wanted to bring it up to say that, again, even if you don't know whether someone has been touched by addiction, there's a pretty good chance that they have been. So,
Man, I appreciate that. You said something again. So I do a lot of reading in the evenings, right? I'm trying to get out of school and finish up this PhD, but I spend a lot of time reading. And I was reading the Journal of Psychology, and it talks about how this society is conducive to addictions in terms of how fast the society is. And so I'm 61 years old. I can remember a time when life was a lot slower, life was a lot more smoother, life was a lot more gentler. There was no internet, there was none of these things that's constantly bombarding the mind with all of this coming at you, right? And there's no way to disconnect. When I was growing up, there was a commercial, and it was called Cow Dawn, Take Me Away. It was basically this soap that you put in your bath, and it was Cow Dawn. You sprinkle it in there, and it gave you like this real smelly stuff. It was like Cow Dawn, take me away from a stressful day, right? Now we went from Cow Dawn, taking a bath, taking me away, to beer, to marijuana, to alcohol. And even when you go to the doctors will tell you, hey, here's what you need, here's what you want, and here's what you might have to have. And so without further ado, I will go back and share what I said originally, that my father always told me that, show me where a man spends his time and his money, and I can show you what he loves. And so when I meet people, I use that to measure them. The gentleman that I'm talking about has always put North Carolina first. He has always been what I call a servant of the people. When I met his parents, I saw why and how and where he got his pedigree from. His father was famous for starting the law firm in Charlotte. I tell the story all the time about, people say that I'm a fan of Josh Stein. I'm a fan of his work ethic. I'm a fan of what he stands for. I've always been impressed with his education. He's a graduate of Dartmouth. He's a graduate of Harvard Law School. He's a graduate of Harvard Kennedy School of Government. He has served his community. I say this publicly every time I go, while he is the Attorney General, and in my hope and my prayer that he is the next governor of the state of North Carolina. He currently lives somewhere in the Raleigh area. I won't pinpoint him. He's married. He and his wife have 3 lovely kids. Anna is his wife. They tell me he used to play soccer. I can't imagine that, but they tell me he did. As I told you all the story earlier, I was on the campaign trail and I got invited to speak at the governor's school, and they had these kids there. And so as I was talking and I finished, this young man came up to me and was talking to me. He never said who he was. He never said who his father was. And he was so articulate. And I looked at this young kid and I was like, wow, somebody has groomed this kid. This kid right here is the full package. And this is a high school we're talking about. I had no idea who he was. I later found out, months later, when I finally met Josh Stein, that was his son that I was talking to. So without further ado, I'm glad to introduce the AG, soon to be, God's will, my prayer, the next governor of the state of North Carolina, Mr. Josh Stein.
Sheriff Kimbrough, my question is was this recorded? Because I want my mom to see that. Awesome. Sheriff, thank you for your kind words. More importantly, thank you for what you do for the people in Forsyth County primarily, but you also are such a leader on criminal justice issues statewide. You're benefiting the residents of North Carolina all across the state, not only your constituents in Forsyth. So thank you for those warm words. Thank you for what you do. And it's very much my pleasure to be with everyone today. I want to thank you for inviting me to join you and to talk about an issue that's close to my heart, as I know that it is for many of you, which is about getting help for people who are struggling with opioid addiction or other substance use disorders so they can lead happy, healthy lives. I mean, that's truly what we want for every person, is the ability to have autonomy over their lives on a day-to-day basis so they can pursue their dreams. And that's what we're about. It's been one of my top priorities since I was sworn in as your Attorney General back in 2017. We tragically are at the deadliest moment of the deadliest drug epidemic in American history. It's raging worse than ever. In 2021, the last year we have full data, 107,000 Americans died of a drug overdose. That represented a 16% increase over 2020, which represented a 40% increase over 2019. So we're in a truly awful place. About 2/3 of those deaths have a synthetic opioid involved, primarily fentanyl. In North Carolina, the number was 4,000 overdose deaths. These are records, both in North Carolina and nationally, we never want to see broken again. Too many people know what it's like to struggle with addiction, to care for somebody with active addiction, or worse, to lose someone we love to an overdose. And you all have seen and experienced some of this pain firsthand. I genuinely believe we can and we must build a future where people can live free from addiction. And I'm grateful to the role that Partners Health Management is doing by showing up in so many North Carolina counties, keeping people alive, getting them help, and supporting them on their path to recovery. I've been focusing a lot of my energy on holding the big drug companies that created and fueled this crisis accountable so that we can deliver meaningful treatment and recovery resources to North Carolinians. The companies made billions and billions and billions of dollars while millions of Americans got hooked on their pills. So my team at the North Carolina Department of Justice and I put together and led a bipartisan multi-state effort of nearly every state attorney general in the country to take these drug companies to court, and we're winning. We've secured in hand $26 billion, and then we have other deals that are in process of another $25 billion. So in all, we're looking at more than $50 billion nationally to fight the opioid crisis. Our overall share in North Carolina would be about $1.4 billion. The $26 billion that I've already mentioned, those were the 3 drug distributors and Johnson & Johnson. That money has started to flow. We've already received $93 million in year 1 of that payout. These other deals are a couple of generic drug manufacturers that total $7 billion, and the three major drug pharmacy chains, CVS, Walgreens, and Walmart, is another $13 billion. So again, you put it all together, it's over $50 billion. The money is in North Carolina goes predominantly to local governments. 85% is going to either counties or big cities. 15% is going to the state. We chose to do that intentionally because we know this is a crisis predominantly felt and addressed at the local level. It is Sheriff Kimbrough's jail where a lot of these people end up. It is Forsyth County EMS that responds to these calls when folks overdose. A lot of the treatment providers and nonprofit service providers are local and have real deep connections in their communities. And so that's why we structured it the way we did. We wanted to hold the companies accountable, the entire drug chain from manufacturer, distributor to pharmacy, but we also want this money to mean something. And we have put strict restrictions on how the money can be spent, whether it goes to the local government or it goes to the state. It has to go to prevention, harm reduction, treatment, or recovery solutions. Now, in December, Partners organized a meeting with each of the counties it serves, along with my policy director, Steve Mange, and Nidhi Sachdeva, who works with the Association of County Commissioners, to talk with counties and explore ways they can use the funds to save lives and improve health. And I want to thank you all for the leadership in pulling that meeting together and helping the counties think through strategically about the best uses of these opioid settlement funds. Some of the most pressing needs of the moment that we're seeing all across North Carolina has to do with the need for more treatment and recovery resources. We know treatment works, and we know medications are an essential part of treating opioid addiction. MAT, medication-assisted treatment with methadone, buprenorphine, naltrexone, that is the gold standard for treating opioid addiction. And the evidence for the effectiveness of MAT is overwhelming. And it's been great to see counties across the state embracing this approach. A lot of communities have started to integrate MAT with their EMS post-overdose response teams and create mobile units that make the drugs more accessible to people living particularly in rural communities. And we simply need to see MAT made available more broadly across the state. Hand in hand with helping people get healthy is helping them stay healthy. And the settlement funds can be used to fund recovery support services, things like housing, employment, transportation, the barriers that arise in people's lives that get in the way of their successfully re-entering and reintegrating back into their communities. Because the last thing we want is for people to get the treatment they need, but then not have the help that they need to continue on their path to recovery. Another permissible use of the funds involves criminal justice diversion programs. As you all well know, many people involved in the criminal justice system have mental health or substance use issues. I'll be interested to hear from the sheriff, but I wager that 3/4 of the people in the jail have either mental health or substance use challenges or both. And when I took office, one of the first things I did was go to Fayetteville to meet with their law enforcement assisted diversion program. It's all about recognizing people who are in trouble with the law because of their addiction. If they were not addicted, they would not be breaking the law. So that if folks can get with substance use disorder can get help, they can avoid having to go to jail and they can reduce repeat crime. So it's all about moving people out of the criminal justice system and into the healthcare system. And there are a number of counties and cities that have LEAD programs, law enforcement assisted diversion programs. And I really want to commend law enforcement for their innovation and their willingness to realize that you can keep pounding your head against the wall, but you're not going to arrest yourself out of this problem. And folks realize that, and they're looking for new solutions. And I also want to acknowledge the North Carolina Harm Reduction Coalition for really pioneering and pushing these initiatives across the state. In addition to the pre-arrest diversion, There are actually impressive post-arrest diversion programs across the state. Drug and recovery courts are a prime example. Another initiative is offering MAT to people who are currently in county jails. People who leave incarceration are at dramatically greater risk of overdose death than the general population. So if we offer treatment to folks in a correctional setting and then have a warm handoff to them, to service providers in the community when they leave incarceration, it makes it much more likely that those people will succeed in whatever their dreams are post-release. And with overdose deaths at an all-time high, many counties and communities are also investing in harm reduction strategies. The philosophy of harm reduction is very simple. You meet people where they are, you help them stay alive, you build trust, and whenever and however you can, you connect them to services, because we want them to get better, because we all know every life is valuable. Several counties in North Carolina have implemented their own harm reduction syringe service programs through their county health departments. People with addiction who participate in syringe service programs are 5 times more likely to get treatment ultimately than those who do not participate in such programs, because they are regularly engaged with somebody. They build trust with that person. Often that person is a peer, somebody who has walked in their shoes. And so when that person has that moment, when they are ready to get help, they have a relationship with somebody they can call and say, can you please connect me to treatment? Can you help me? And then they're able to provide that help. Another harm reduction strategy that's necessary to save lives is naloxone distribution. It's that miracle drug that can reverse a drug overdose. Many counties have strong naloxone distribution programs that are sponsored by their county health departments, and we need more. But look, treatment and medical care, it's not free. Doctors, nurses, opioid treatment programs, other providers, they all need to get paid for the healthcare services they provide. None of us works for free. And many people with addiction cannot afford to pay for their care, which means that they're much less likely to get treatment that they need. We have to have healthcare and health insurance available and accessible to more North Carolinians. And that is why it is a long time past due for North Carolina to simply say yes to the federal government's offer to expand Medicaid. Expanding Medicaid would improve the health of hundreds of thousands of North Carolinians, save thousands of lives a year, strengthen struggling rural hospitals, reduce the burden on underfunded emergency departments, and create tens of thousands of jobs across the state. And I want to thank and appreciate the fact that Republicans in the General Assembly are finally embracing the concept of Medicaid expansion. Governor Cooper has been there since day one, 6 years ago, but it's one thing to talk about expanding Medicaid. That doesn't do the job. You've got to expand Medicaid. So I am hopeful that in the coming months, North Carolina will join the vast majority of states that have said yes to expanding Medicaid. I urge you to talk to your state legislators, your senators and your representatives, and tell them to not miss this moment, to take advantage of this open window of opportunity and go forward. Here in North Carolina, it's essential that local governments have the tools and information that they need to make the best use of these new settlement dollars. And it's critical that the public, all of you, know what decisions their leaders are making. How are they investing the money? Was that investment effective? So my office developed something called Core NC, the Community Opioid Resources Engine for North Carolina. Core NC provides extensive data and resources to help local governments make the best use of their settlement funds. And critically, it ensures transparency for the public and accountability for government, because when people have more insight into what decisions are being made, policymakers make better decisions. So local governments have to publicly report who they funded, how much, and what were the outcomes. Because if that investment is not delivering results, we want the local government to switch strategies and find one that works. So I encourage you to check out Core NC. The website is ncopioidsettlement.org. ncopioidsettlement.org. And maybe somebody can put that in the chat, would be very helpful, ncopioidsettlement.org. In recent months, I've been traveling all across the state, visiting with county leaders to learn about their initiatives and their plans for the funds. In Asheville, I visited Buncombe County Jail, which has a stellar medication-assisted treatment program that gets people using MAT in jail and then connecting them with others on the outside. Orange County has a very similar program called the Lantern Project. Charlotte, I met with the Queen City Harm Reduction. They are distributing syringes to thousands of people who need clean syringes. In Fayetteville, I talked about law enforcement assisted diversion. In Jacksonville, their detox facility and community paramedics. In Dare County, talked about the probation and parole services. They're able to double the capacity of their drug courts by hiring another probation officer. So there's so many things happening that it's truly inspiration. I feel incredibly privileged to have been able to travel and learn about the good work that's happening. And it's almost universal. It's certainly uniformly good work. There are so many passionate people across North Carolina on this issue. People who have overcome their own addiction, people who've lost a loved one to overdose, and other people who are simply called to this because their hearts have a heart of service. The work is creative, it's dedicated, and when you combine that power that exists with the resources that we've secured from these big drug companies, I am absolutely certain that there will be more people alive and healthy next year and the year after that and the year after that in Forsyth County, in North Carolina, than there otherwise would have been. I know that you guys work on this issue and you understand better than everyone that there are no simple solutions. There's no single solution. There's no light switch we can flip to make this crisis go away. Frankly, it's grown over the course of decades for us to get to this terrible place. And it's going to take hard work, collaboration, and frankly, time to get us out of it. But I am incredibly optimistic about what we can accomplish together. And I hope that you feel the same way. Making sure that the people of North Carolina are safe, healthy, and happy. It drives me in my work every day as your Attorney General, just as I know it drives you in yours. And I'm excited to work with you all, God willing, in the months and years to come to build a better and brighter North Carolina, one that is safer, stronger, and healthier for every person. I thank you for having me this afternoon and look forward to any questions if there are.
I think Abby's gonna.
Yes, so we've had a few questions come in. First one, so what are some examples of strong evidence-based programs you've seen that make a real difference? I think you mentioned a couple of those.
Yeah, I did. And I'll tell you about the Asheville program. So they've done the program, but they've also evaluated their program. And what they've achieved up there is pretty remarkable. The opioid overdose death rate of people leaving incarceration in Buncombe County is lower than that of the general population. Whereas statistically, usually it's 40 times higher because people are addicted when they go to jail. They're addicted when they're in jail, but they're in detox. They come out, they're still addicted, and they use at the amount or level that they had used before they went into jail. And tragically, it often kills them. But Buncombe has seen great results in that regard. In Hickory, their law enforcement assisted diversion program has been shown to reduce recidivism. So that's another evidence-based strategy. And I talked to you about how harm reduction strategies have a record of better connecting people to treatment than just letting folks exist in the community.
I think Sheriff Kimbrough has now has the machines, the vending machines in the jail that you can walk in and get, which is another great. We've actually had somebody run in because someone was on the street overdosing, and someone ran into his jail, grabbed the Narcan, and went out and saved their life. So I commend Sheriff Kimbrough.
Sheriff, thank you for doing that.
Leader.
Okay, we've got one more. Let me just skip. We've actually got a couple, so let me find this next one. Are there any plans for additional state funds for opioid and substance use treatment?
Yeah, so we've secured the $26 billion. That money is it's finalized. Those deals are signed, they're over, and it's already started to flow. These other settlements I talked about are in the process of being finalized. Now, it's a two-step process. Did enough states join it to satisfy the defendants? Because the defendants reasonably want global peace if they're paying these billions of dollars. And we met that threshold. So as we speak, these deals are before the counties in North Carolina for their deliberation and consideration. I'm highly optimistic that we'll have universal adoption of these deals, just like we did the first time. We had 100 counties, everyone in the state join us. And we want 100 counties to join us again, because if we don't, our state's share will decrease. So we are going to work with the counties to so that they get comfortable with these deals and join them. And then essentially, it won't quite double the amount of money coming to Forsyth County, but it nearly will. So that's job one for me in the first quarter of this year. And then I'm going to continue to work with the counties to make sure that the funds are being used in the best way possible. We're going to make sure that this core NC website, ncopioidsettlement.org, is high functioning so that voters can know what's going on and make sure that they're satisfied with the decisions their leaders are making. There's some other things that I've been working on that don't have to do with these settlements, but it has to do with trying to change federal policy. And I'm really proud. It's a pretty technical accomplishment, but the Oklahoma Attorney General and I put together a coalition of 39 attorneys general to urge Congress to change a law, because MAT, this medication assisted treatment, prescribers had to register and take a special course to prescribe buprenorphine, but not to prescribe opioids. Any doctor can prescribe somebody an opioid, which is highly addictive. Buprenorphine is the drug that is not dangerous, or not nearly as dangerous, that treats addiction, but there was stigma attached to prescribing that drug because they had to get something called an X waiver. Well, I wrote Congress and urged them to get rid of that X waiver because it was stigmatizing and it was a barrier to doctors doing this work. And therefore, it limited the number of people who could get medication-assisted therapy. And I'm thrilled because just, I think last month or the end of, I couldn't remember, I think it was in December, Congress finally passed that law and got rid of the X waiver. And so we should see much more MAT going to help people who are struggling with addiction. So that's something I worked on that I'm proud of. And then I've urged the FDA and the DEA to extend telehealth flexibility that expired because of COVID, that was inspired because of COVID. We don't want that flexibility to go away because it's been really great, particularly in rural North Carolina, where it's hard for people to make their way to a doctor for an appointment. If you can do it through telehealth, you can really extend the reach of MAT.
That's also true for folks with disabilities like myself, by the way. So that's worth keeping in mind as well. Thanks.
That's very, I appreciate that point. That's helpful.
Josh, thank you for all your efforts, both yourself and Sheriff Kimbrough. I've worked with you on several panels and in several places over the years through this opioid epidemic. Both of you have the ultimate degree of just no stigma and truly caring and truly bringing to the table this non-judgmental attitude. So even myself as the mother, while Toria was addicted, I judged her. I judged people that I saw, and I judged her friends. And to see you both, what you're doing in the community shows this non-judgmental. Even our doctors, when we went before she passed away, she would come out and she's like, they think I'm scum. The difference in the way people will react to us and people will come for help is exactly what the both of you exhibit. And this is a love and a non-judgmental, Christ-like love of our fellow human being. And I can't thank you, either one of you, enough for what you've done, for being here today with us, for being a part of our community. And I'm so grateful, Josh, for you and for Reba and for your whole team helping me put this together, Sheriff Kimbrough and Alicia and your whole team. Josh, you don't know, but 1 year ago today, Sheriff Kimbrough invited me into his office to present an opioid prevention kit based on my daughter's artwork and things that we did for the smallest of children. And he today carries those in the sheriff cars and gives them out at no cost to these children when there's opioids involved at a call. So thank you both from my heart. And I hope to present you with one as well, Sheriff, Josh Stein, our North Carolina Attorney General, soon to be governor.
Thank you, Susan. Thank you. And I did not know about the exchange you have with Sheriff Kimbrough, but his reception doesn't surprise me at all. That's in keeping with who he is.
Thank you. And this amazing team at Partners, it's time to wrap up, but I want to give Jackie Copeland a minute to say a few final words and to thank you all for being here today and to remind you that we meet the first Thursday of every month from 11:30 and normally till 1, but today, with respect to our panel, thank you very much. And we're going to close at 12:30. Jackie?
So she come off mute first. Thank you, Susan. First of all, I want to say thank you again for Attorney General Josh Stein, along with Sheriff Kimbrough, for taking time to share with our community. We are trying, as partners, is a member of the Forsyth County and working with other community agencies to try to make sure that we can address this opioid crisis. Because as you all shared and we've heard, we want to decrease the lives that are lost senselessly due to opioid use and any mental health or substance use issue. I appreciate you, Matt Potter, for sharing, kind of expanding the conversation because it does need to be talked about. And again, on behalf of Partners, we're just glad our kind of role here is, along with being the member care organization for services here in Forsyth County, we also have the privilege of working with Susan and Matt, and we staff both of their committees. And I want to give a round of applause for both of those committees that came together and put this conversation together. They led this initiative. Partners' role was just to be here to make sure we had our expert Abby here to make sure everything worked well. So thank you, Abby. So we just want to say thank you for Forsyth County and also for the two committees, the MHSU Advisory Committee and the Intellectual Development Disability Advisory Committee here in Forsyth County for the work you all do on behalf of all the families and members in our county. Again, thank you.
Sheriff Kimbrough, do you have a final word?
Again, as I was saying, it's always a pleasure to be in such high esteemed company with you, Susan, Partners, and especially I refer to him as soon to be Governor Josh Stein. It's a pleasure and it's an honor. And like I said, before, we must continue to build collaborations, cooperations. That's the only way we're going to fight this. We say all hands on deck. And again, keep fighting the good fight. Love you all.
Thank you.
Thank you.
Bye-bye.
Thank you both. And motion to adjourn.